So first of all, thank you very much indeed for taking the time to join us today. Very much appreciated.
Thank you, Stephen. Thank you for having us here today, and thank you for being part of the 47 Conference of the Union.
So confronting resistance, what do you mean by confronting resistance?
I think there are two particular topics led us to choose this theme for the conference. One is confronting antimicrobial resistance, which has been a major issue on the political agenda this year as countries met in New York during the United Nations Special General Assembly session. But also we wanted to speak about confronting resistance to change that impedes the progress in the fight against tuberculosis and other lung disease.
A lot of the interviews we've done at the conference, a lot of the sessions we've filmed have been very much about how you engage communities in combating that resistance to change, as you say. How important is that around the world?
It's very important. The involvement of the community is crucial in the effort to fight tuberculosis. We believe that at the Union. For example, in our Myanmar office, we engage with nearly 1,300 community health workers who volunteer to provide and assist services to our patients with HIV. In India, we have over 25,000 volunteers who assist from the community, from the affected communities. It's very important that we listen to the community, that we understand what are the challenges that they face in accessing the health services, and that we also work with them to ensure that they support the patients, that develop the bond with the patient that will lead to treatment success.
You work in so many countries. When it comes to governments around the world, how do you persuade them to put the appropriate kind of funding and leadership into combating TB?
Well, tuberculosis is a disease. It is not a tragedy. And it affects people in the most productive years of their lives, in the years when they're most productive to a society, to the economies of those countries. When we speak to governments, we must present the economic arguments to those ministers, to the countries, to show that, first of all, the investment in healthcare and the prevention of this disease is less than what it will cost to deal with the disease if people become sick, but also in alleviating the human suffering, the tragedies, the impact that this has in families and communities.
What about the Union itself? What's the Union's role in fighting TB?
It was a dream of the founders of the Union to find a common approach to deal with the problem of tuberculosis globally. And we have done that in many ways with the different strategies that are used for controlling tuberculosis globally. So the Union as a convener, as a scientific organization, as an advocate, has a responsibility to ensure that the countries and the communities are utilizing those standard methods to control tuberculosis.
So my final question, I was reading your annual report, and you wrote in that this is a pivotal year for the Union, that there's a lot of change going on and it's a pivotal year. So what's next for the Union?
I think what is important now is to help the countries roll out the new short regimen for the treatment of MDR-TB. This is crucial. We now have a treatment that is shorter. The WHO has revised the standard guidelines for the treatment. We must now assist the countries to implement this, to roll out this as quickly as possible so that patients may receive the benefit of this new shortened treatment.
Well, thank you very much indeed for joining us. What a successful conference it's been.
Thank you very much, and welcome to the 47th Conference of the Union.